Thank you everybody for coming. I'm Amar Adlibi. I'm going to be talking to you today about some pediatric dentistry. Some people were asking why we're doing this and why is it for free. One of the doctors called and said, what's the catch? And there's no catch. Actually, the thing started because we have a lot of general dentists that refer to our office, a total of 153, right? About 153 general dentists refer to us, and we wanted to give something back in return rather than the usual dinner gift card that we've been giving out. We decided I felt like I want to give something back to our referring dentist, and the best thing I could offer is help them with their practice of pedo at their offices, and maybe even refer less to us, which is still fine with me. So, and then we decided, since we are doing this, one might as well just extend the invitation to all the other dentists in the area who are not even referring to us. So that's how you guys probably got our mailer, and thank you for coming here. We started this. We're not a chain. There's no corporate headquarters in somewhere in the Midwest. We're just a simple practice that started about 7 years ago, 2007, in Bristol. We started with 2 chairs. We grew tremendously in the past 7 years. This office is new. This is only about a year old. We'll have our 1-year anniversary next month. Like I said, we started with 2 chairs. Now we have 9 chairs, a total of 20,000 active patients, 35 employees, and 4 or 5 associate doctors. So there's something we're doing right, apparently, and I'd like to share that with you. This is not meant to be a practice management or a business management course or lecture, although it's something that I thought of doing maybe in the future. It is more like this. There will be a hint of practice management, obviously some issues I would like to bring up that will be beneficial, and I'd like to share my story of success with you and give you some of the tips that helped me get to where I am right now. So obviously there's a reason why you guys are here. The obvious reason is you are pursuing an improvement. You are seeking to learn something new, so this is a great advantage. This is actually the pursuit of excellence is what brought you here, and I think this is the most important ingredient in success. And I'm telling you from my own experience, from my success story, the number one most important thing that will help you to help us all to get where we are is the pursuit of excellence. And if we have that in our mind, if we're settled with what we're doing, and we don't have any ambitions to get any improve in any way or get anywhere to where we're supposed to be, then obviously we'll stay where we are. The pursuit of excellence is what brings us here today, and what motivates us to get to the success we are all looking forward to. Now, the excellence, like Albert Einstein here said, and a lot of things that you hear and you read on the internet about what Albert Einstein said are not true, but this one is one of the true ones. If you always do what you always did, then you always get what you always got. So if you're happy what you always got, what we got, and you're happy and satisfied, then you can pass an opportunity like this to learn something new. I personally attend a lot of CE courses. I exceed a lot more than what is recommended for maintaining the license status. And I think the way my attitude is, if I go to a CE course and I find 90% of the CE course is not relevant to me or not interesting, I didn't learn much that I could apply. But if I learn only 5% or 10%, one thing that I can apply, I think I feel like I've accomplished the purpose of the CE course. So I know you guys, a lot of you probably are a lot more knowledgeable than I am, especially in the area of general dentistry. And many of the things that I may talk about here may not be new to you, so please bear with me. If you get even 5%, something that you can apply, even one tip, I think you would have accomplished the reason for coming here. This is our motto, excellence in pediatric dentistry and orthodontics, and we really mean it, and I'll talk to you in a bit about that. In your case, be excellence in general dentistry, and this is something that we all should be striving for. And let's define excellence, and I have actually highlighted some of the things here. First of all, like I mentioned in the flyer, none of the things I'm going to be talking about here is from books. It's all from my personal experience. I've been practicing pediatric dentistry for over 20 years, and I learned a lot from my mistakes. Mostly, you learn a lot more from your mistakes than anything else, from reading books or taking courses or any kind of education, and I'd like to share those with you. I think you will benefit from examples. I will mention the mistakes that I learned my lessons from. Everything is from my experience. I'm trying to condense my 20 years of experience and present it to you in a way that will hopefully help you. So I listed basically what I meant by excellence here. We have number one, excellence in customer service. And again, this is not a business practice / practice management lecture, but this component is important to just highlight briefly. I can make a whole course for probably a whole day talking about the business aspect of dentistry, but this is what I mean when I say excellence in pediatric dentistry and orthodontics, or excellence in general dentistry in your case. Number one, and I mean number one, excellence in customer service. So everybody nowadays, we're at a time where everybody expects to be pampered, catered for. They expect a boutique service. When we give them that, then this is the biggest boost for our reputation, and this is our biggest source of growth. We all know, in case you don't know, but the number one source of our growth and patients is word of mouth. So that's our main focus. This is the one thing that we need to focus on and protect. That's as I will be talking in a few more about that. And the number one thing that will influence our growing the aspect of word of mouth is excellence in customer service. Now, people go and talk and say, I want this. You can do a great crown, a great perfect margin adaptation on an MOD or an excellent restoration, but people are not going to talk as much as if they say, oh, I went, they would agree with me. They were so friendly. They offered this, they offered that. They have a lot of dental offices. They have a spa there. They have I know if a pediatric dentist in Massachusetts actually offered donuts in the morning. I mean, I wouldn't do that for the obvious reasons. But things like that, people like this kind of superior customer. It's called 5-star customer service. One of the things that I am planning to actually implement recently in our practice, I learned when I went to one of those fancy hotels. I went to a course in New York, and when I checked into the hotel, they gave me a very nice, elegant card, a welcoming card from the owner of the hotel or the CEO, and there was some little chocolate eggs in a nice baggie with this ribbon, and I thought that was very impressive. So we decided to do that for our new patients. We're going to give them a welcome card with our logo and our information, and it will be like, if you have any concerns, please bring it up directly to me, the owner of Kids Dental Care. Just like Ken Crowley, if a customer is not happy, I want to hear about it. And I want to hear about it, and I mean it. So, and I instructed all my employees, and if any patient is complaining, anybody is unhappy, they let me know, and I handle it personally. And sometimes it gets overwhelming, sometimes not that we get a lot of complaints, but little things, sometimes it has to do with billing issues. I have to be informed and make a decision whether to waive that or give them some concessions to make them happy, or so on and so forth. So second thing is obviously excellence in selecting, training employees, and this is something that my office manager, that is something that's his job. Actually, I'm totally out of that part, but I can say safely he mastered this part. So he is my number one real reference with selecting and training employees. We have had people talking to us. We have a speaker who actually gave a special training, one-on-one training to my office manager, Sally, regarding training and hiring employees. Excellence quality of care, we all know that, doing the perfect restoration, the perfect crown, all that. So if I'm personally perfectionist, the way of I've been called OCD when it comes to doing things and putting the anatomy on the filling and all that. But even if you don't have that, it's something that you should acquire. I think if it's not naturally in your personality, you have to have that when I work on something. And this is like my own son, my own daughter, my sister, and I want to make sure that I'm doing the most perfect thing. And if you have this attitude, people will know it. They will detect it. They will sense it. There's no doubt about it. If you are, and I'm not saying that you are, if somebody is sloppy and just want to do patchwork, then people will know it. They will somehow, there's something about you that will convey it, and they will sense it. And I had a a lot of compliments from people telling me that, oh, I'm so impressed by how meticulous you do this work and how you pay so much attention to details, even though they're just parents, they're not dentists, they don't judge my work. Excellence in evolving, improving, and updating. We are evolving every year. I mean, you look at our practice only last year, it's tremendously different than it is now. It is a huge jump from the way it was 3 years ago. It's almost like a totally different practice. We always implement new things. We add new things all the time. We, whatever, like I said, I go to CE courses, I read whatever things that are being the latest in technology, for example, we acquire it. Whatever the latest evidence-based new materials, we get it. For example, we have the laser dentistry. We went to the courses there, the training. Now we do laser phenectomies, laser restorative dentistry. We switched the materials periodically. We started the good old traditional formicrosol for pulpotomy. Now we are using MTA, we're using antibiotic instead of the traditional formicrosol. So we evolve continuously. Again, going back to what Albert Einstein said, if you want to get the same thing that you're doing, you keep doing the same what you're doing to get what you're already got. And if you want to improve, then obviously you have to do different things. Excellence in crisis management, we'll talk about that right now. Towards the end, this is something that is going to be discussed in details. Excellence in marketing, I think we mastered that part too. We have everything, we've tried everything you can think of, everything you can possibly think of in terms of marketing we've tried. Billboards, TV commercials, radio commercials, postcards, what else? Newspapers, specific mailers, anything you can think of, we've tried it, and we analyzed what we do, and then we come to a conclusion which works best, and we focus on that. More important than external marketing is internal marketing. We've done a lot in internal marketing. We do a lot more focus on that because we want to retain our existing patients and again feed our word of mouth effect. And the things that we think out of the box when it comes to internal marketing, we give expensive gifts that cost $1 or $2 each. Like we have mylar balloons, foil balloons. We have a helium tank in our office, and we fill them, and they have our logo. And it's like, the way I think about it is like I have my own billboard in those parents' home that's not going to be deflated for 2 weeks, because I calculate it takes 2 weeks for it to deflate. So I have my billboard in their home for 2 weeks. Okay, and that's what $2 are buying me when I give it to the child. Not only am I making the kid happy because he got a balloon with a ribbon and it's flying, but I also got my billboard in their home for 2 weeks, unless it flies over there. So things like that. Now I could talk, like I said, a lot more about that, but this is just briefly what is meant by excellence. Now we're here to talk about you guys practicing more pedo, so I call this unlikely potential because we all have this potential. You guys do, I think, with the type of work that as specialists, we're focused on kids. You guys are a lot broader than us, so I think you have an advantage over us. You have more. I firmly believe you have more of a manual dexterity than someone who's focused on one thing only. So you have a lot more potential than someone who is only a specialist, although we have an advantage of having this extra training and education and experience with that one specific specialty, but you guys have a different kind of advantage with being broader than we are. So you can treat more children. The typical thing that I always hear is, oh my God, how do you guys deal with kids? They're screaming, crying all the time. You just want to get them out of my face, send them to you, but you deal with them. But that's not the case. You need to know, and this is something from my experience and also in books, at least 80% of children are cooperative, and at least 80% of children you can work on as general dentist. And they're not going to cry, they're not going to scream, they're going to give you a hard time. Now, the 20% that are crying, screaming, giving you a hard time, they don't want to deal with, you can send them, you can refer those, and we can talk about how we do that. But the 80% that are your right to keep, and that will help you in a lot of ways, as we're going to talk about right now. They will boost your overall practice, and in many ways, your reputation, your production, your growth, your adult patients, as you can see in the next thing we're going to talk about. You can increase your revenue, obviously, and let's talk about that first. let's see here. I did this little comparison, and this is something you can do in half an hour. It's just an average. It could be more or less. And this is what we do here when it comes to I use Delta fees here as a private insurance fees, and compared to Husky fees, which is inferior usually for the same amount of work. Just so I can even use the stark comparison, which is the best you can do on an adult with private insurance versus what you can do on a child with a Husky or Medicaid insurance. Now here we have one quadrant on adults, and let's say you have number 18 one surface composite, the fees 115 for Delta fee for a one surface composite, and you did a 19 MO, you got 153, so a total of 268 in half-hour appointment. We can do this easily, and this is not the most we can do. We can do a lot more than this, by the way. But let's say we did only this. So we did one C-lat and quadrant, number 19 KMO, L pulp and crown. We have total of 553. You made 268. So see the difference in half hour in pedo. So this is what you can do. This is what you should keep. This is all the 80% of the cooperative kids who would let you do this easily. This is yours to keep, and that's the difference in revenue alone. Now another example here. Let's see, you could do more. And we can easily do something like that here. This is an adult corner that's extensive. And I'm not talking about crowns, endo, because endo, crowns, things like that, dentures, they take more than 1 minute. I'm talking about something you can finish and complete in half an hour, or maybe 40 minutes at the most, 45 minutes. So here's a 1-3 surface, 18 MO, 19 OD, 20 DO. I mean, again, Delta fees, private insurance, 500 you made. That's really a big, a lot of fillings on one quadrant and on adults. You could do this much on a child easily if he or she is cooperative. K pulp and crown, L pulp and crown, 19 including composite, got 800, and that's Husky fees again. Medicaid fees, 841 versus 5. So you see the difference in what you can do in one quadrant. How much can you do in 10 minutes on an adult? How much can you generate? Let's see what you can do here. I don't know. I can't see anything you can do in 10 minutes and complete and make this much. But we can do this. And this is the thing we're going to talk about in the next course. I know a lot of people find it hard to believe they can do a space maintainer from A to Z, finished, completed, cemented in 5 minutes, but yes, we can. And I'll show you next time. And actually, because you guys are here next time, you will be, well, 3 things before we leave, by the way, since if you guys start staying with us. Number 1, we need to determine the next, the date for the next course. It's going to be in 1 month from now for the space maintainer. I'm going to show you hands-on on typodons, how to do it. I'm going to show you videos. I recorded myself doing it in 5 minutes. Actually, it was 6 minutes to be exact, because it took a little bit more time about talking. Let's say 10 minutes at the most, so you can do this much in 10 minutes. I don't think you can do anything like this on an adult in 10 minutes. So the one thing is, before you leave, we determine the date. The second thing, please complete the form before you leave, even if you have to leave early. And the third thing, please listen to Saleh, my office manager. He's going to talk about something very important, which is the auditing that's happening right now from the Medicaid, that you need to know some information. He knows more about me than this. So those 3 things that I really urge you to make sure we do that. So this is what we can do. That's as far as production is concerned. Obviously, we're here. Although we have a noble mission of treating kids and making their lives better, improving their quality of life, eliminating the dental disease, which is all a nice thing. But at the same time, we are in business, so we need to make sure we're not losing business. So when I talk about business, it's not like I'm not trying to reduce down our profession to nickels and dimes. So obviously, practice makes perfect. Whenever you do things more, you get more comfortable with, and this is something, it's a general notion, everybody knows that. Even with endo, that a lot of us are not, most of us are even not comfortable doing molar endo, for example, or second molar endo. But for an endodontist, it is so easy. Actually, one endodontist told me, I do molar endos with my eyes closed. He can do it while he's having a conversation with you. He just does the endo. That's what he does all day, every day. So to him, it's his comfort zone. It's easy. It's a piece of cake because he does so much of it. And experience, practice makes perfect really is a great thing. So when you are in your comfort zone and you do something you're comfortable doing, then you enjoy your work. You don't have any stressful day. You're not worried about a stressful procedure, because this, and that's what I do myself personally. By the way, I only treat up to 10 years old. anybody over 10, either my associates, my poor associate have to deal with, or we have a general dentist who does the teenagers, because to me this is considered adult dentistry. It's a full permanent dentition. I prefer not to deal with it. I like to do what I do best, what my comfort zone is under 10 years old. And that's why, because I have been doing that for so many years and I'm so comfortable with it, this is, I can't think of any stressful procedure that I have to worry about during the day. I mean, even a screaming, crying kid, I always have a plan, a strategy for that will save me the stress. So I'm not going to be stressing myself about any procedure. And this is what you guys can do with pedo. When you get to expanding your comfort zone, and realizing, first of all, recognizing your ability to treat more children, and knowing that most of them will be cooperative, then you'll have this, you expand your comfort zone, and then you get this feeling that I have, that if you have a child, it's not a stressful procedure, it's another easy, if anything, it's even easier than adult. And without a doubt, treating kids is a lot easier than adults. I mean, you can get adults who can give you hell, I mean, excuse me, but with the way that their expectations, unrealistic expectations, some of them are OCD about their teeth, and they like things to be a certain way, and you can never make them happy, but you won't get that with kids. Kids always make them happy. What defines a great dentist in the eyes of a parent? That's when we're going to start with that first, and we're going to break it down and go through the details after, so that you can be a great dentist in the eyes of a parents. So I came up with something. I think it sums up everything as far as what defines a great dentist in the eyes of a parent, and that's what it is. If a kid cries, you're the best. If he doesn't cry, you're the best. If he cries, you're the worst. It's as simple as that. So when you have a situation, now a lot of parents are understanding, and they know that their child is crying because they're having either fear or anxiety, but a lot of them also, they think that whenever their child is crying, it's because you're hurting him or her. And I remember, I'll never forget that I took my son. He was only 2 years old, and we thought, probably even younger, maybe 18 months old. We thought that he was having a problem with his eyesight. So we took him to an ophthalmologist, a pediatric ophthalmologist, and he examined him in knee-to-knee position. And the kid was crying. He's 18 months old. He's crying naturally, not a big deal. But the doctor kept apologizing to me, saying, "Oh, I'm sorry, I don't want you to think I'm hurting him." And the first thing in my mind, I knew exactly why he's saying that, because somebody must have told him, "You're hurting my kid because he's crying." So that's what a lot of parents, they perceive that you make their kid cry means you're hurting him or her. And you need to be aware of that. You don't know which ones now they're going to think that they're crying because they think you're hurting their kid, and which ones are understanding. And they say that you can hear them tell a kid, "Oh, come on, it's not a big deal, you know, you're fine." Those are the reasonable parents, but the ones that are unreasonable, I mean, to them, you're making them, you're hurting them. So you need to do whatever you can to minimize making the kid cry. And the way we do it as pediatric dentists is, number one, the only reason a kid will cry here is if he or she is doing a quick exam, because they're very young. So that only takes less than a minute for a quick exam. So that minimized crying and out finished, we didn't hurt anybody. Second is, if we're doing a quick procedure on an uncooperative child or a very young child, we only has one or two, one surface maybe quickly. We do it in Fujian in 5 minutes. Okay, now we, as specialists, we mastered the speed part of this profession, where we can do actually an easy, quick one surface Fujian without anesthesia, while here in his mom's lab or in knee-to-knee position, no problem. They know that we didn't have enough time to think that we're hurting them, so that's fast. The other time we do a quick, I think those are the only two situations that I can think that we're making the kid cry. Now, if we're stuck in a procedure, when we have the child looks like he's cooperative, he's doing fine, he or she doing fine, and then they start crying, then we'll talk about what we do with that next. So obviously what makes a kid cry is fear, anxiety, number one, pain, attention, they want the parents' attention. So for many parents, like I said, it is pain, so we need to minimize that. Now, when it comes to behavior management, this is all I'm going to talk about, behavior management aspect. If I can summarize behavior management in one word, it would be praise. You add another word and you have behavior management completed with this tell, show, do. Between tell, show, do, and praise, you have everything you need for behavior management. Now, yes, we are pediatric dentists and we train and I can give you a whole course, probably a whole day course about behavior management and child psychology and the stages they go through and what to do with different types of behaviors. But for you as general dentist, I want to simplify it and just tell you those two things. If you do those two things alone, you can go out very far with just tell, show, do, and praise. And with two things, especially praise, parents, they appreciate that so much. When a parent sees you or hear you praising his or her child, they get very happy. You're on the same wavelength with them. They appreciate that a lot, and they get fascinated, actually, when you do tell, show, do. They still say, oh, wow, the dentist taking his time to explain to my child that this is just a sprinkler, a spring water for the high speed. This is just a tooth dryer and instead of a hair dryer that they could tickle and feel it on their neck, on their sleeves. He's taking his time to show them on his fingers what the low speed can tickle their fingernails, and they call it Mr. Bumpy or the motorcycle, or use the simple words, and they get fascinated literally, and to them you become their hero. Now when they see that you're doing all this, you're using those praising words that they love to hear. You're doing a great job, excellent, perfect. You compliment them on the thing. Oh my God, and it's one thing you can say, or you're wearing nice sneakers, or you say, oh my God, you got Spider-Man shoes here, amazing, this is great. Where you get those from? Same thing on a girl's earrings, well, this is wonderful earrings. Where you got those earrings from? They're beautiful. I can see them shining from a distance. So things like that, engage yourself with passion in praising them. That's what kids like to hear, and that's what parents love to hear as well, and that's what will make you impress the parents, and they appreciate. And then again, feeding your word of mouth factor, which is the number one thing that we need to focus on. Number one is word of mouth factor. Now, talking about word of mouth, and we'll talk about that in the future as actually we go along with protecting your practice and your reputation. You are my hero when you have actually managed to accomplish a procedure on a child, and I'm talking again a cooperative child. Okay, a child who's anxious, fearful, or that's a whole different category, and we'll talk about how we deal with that. But when you are talking about the 80%, the majority, which are the cooperative, and you do this work, and you manage to do a procedure, and you praise them, you tell, show, do, and you make it easy for them, and they leave happy, then you become their hero. And now, one of the things that you need to, that I personally do, and I'd like to share that with you, is when I'd like to enter the child's world. So one of the things that I use to praise them, besides getting, you're doing great, you're awesome, you're acting like you're 10 years old when he's like only 5. Are you sure you're only 5? Stuff like that. And then, do you have an older sibling? And yes. What's his name? He's 8 and I'm like 4. What's your 8-year-old brother is? What's his name? He's Jake. Oh, you're doing better than Jake. Just don't tell him I said that. So now all of a sudden you're talking their language. You enter their world. Now you're telling them you're doing better than Jake. Oh my gosh. Oh, he's gonna get this big smile on his face. Even the mom just smiles and get excited. You get into their world when you use their language, the sibling's name. So now you're their hero. Not only you're their hero, you're their mom hero, the parent hero. Now the mom is going to go and talk about, oh my God, this great dentist, he did some great work on my kid. He's my neighbor's hero, my family's hero, my friend's hero. That's how it's feeding your word of mouth, and that's what the growth is. That's why pedo is so important for you, because when you do something for a child and you do a good job at it for a child, it's a lot more magnified than when you do it for an adult. Because when a parent sees that you did a good job for a child, you become their most favorite dentist. I mean, you are like the greatest guy ever, and they start talking about you, and that's what you need. That's how practicing pedo will help your practice in this aspect of growth. Now, going now to the aspect of protection, and we want to protect, and I mentioned that in the flyer, protecting your practice. The things that I listed here, obviously, that by order of importance. You want to protect your reputation, obviously, number one. And by the way, you guys should always check your online reputation. We do that periodically, all the time. Always go online, Google your name, Google your practice name. Do it like every other day if you can. You'll be surprised. I mean, I don't know about you guys, but if you don't do it at least once a week, then you're missing out, because you don't know if somebody's doing something over there. There's ways to remedy that. We had limited instances of people, a couple actually, two of them when we had people who left poor review, and what I did is one of them, there was a misunderstanding about something. I went to the OR and they were late. They failed to follow their NPO instructions, and we couldn't do the case. So I couldn't wait for them. They left a bad review. Said doctors didn't care to wait for me. I didn't even met them yet because they met my associate. And so to make a long story short, I sent them an apology letter, a long apology with $200 check, and offered to do the rest of their treatment for free and waive the sedation fees, even though they started seeing another dentist because they mentioned our review. Now we have a better dentist that we go to. And I said, if you're kindly enough to remove the review because it conveys the wrong image about what we do, I would greatly appreciate it. They removed the review. It was gone. We're still at 5-star. We have 30 reviews with 5 stars, always all the best reviews. So always go protect. Nowadays, people go, the first thing, I mean, most people nowadays go on Google, they Google your name. When they want, the way they select you is, among others, that they see if you have poor reviews there, then chances are going to pick you up. They're going to pick your next door, across the street dentist rather than you. And if you have there's the other way is, which is planned before. We have not done that. I had that in mind. If I failed to remove a review with those techniques, then there's something called reputation.com and brand.com. You should try and call them. They have ways of either removing the review or pushing them down where they can become invisible. So do that if you have when you check your name and on Google. Now, obviously, you're protecting your practice, which is your investment, your license. You don't want your license to be slapped, get a disciplinary action for something, which we'll talk about also as we go. You want your peace of mind. When you protect everything, the peace of mind is actually a very important thing. You don't want to have to deal with either complaints, lawyers, Department of Public Health, all those things. I mean, this is miserable if you have to deal with any of those things. Now, the protection is better than a pound of cure. And if you work on protecting your practice as we go, as we speak more here, it is a lot more important and more efficient than having to remedy a situation that went out of control, obviously. Now, the things that you need to prevent or avoid, I kind of categorize them in 3 things that can tarnish your reputation. And by the way, I'm going to give you examples. I went through all those 3. I've done all those 3 things. I did things that tarnished my reputation, I did things that damaged my reputation, and I did things that almost killed my reputation. So, and I'll share them with you. That's the idea of having you learn from my mistakes. I done that years ago, learned my lesson. I don't want you to do the same thing to yourselves. So 3 levels of damaging things. Things that can tarnish reputation. Number 1, always poor communication. Poor communication. Making her kids cry. I made her kid cry, and I learned my lesson. I had people thinking that I'm hurting their kid. So that happened to me before. Not seen on time. Unfortunately, happens to every one of us. We have to do something about it. We have to make a point that we see everybody on time. That's the number 1. They say that's the number 1 complaint about the dental practice if they're not being seen on time. So things that can tarnish your reputation is little things like that. You want to avoid them and try to remedy. More work with your staff. Have them in your meeting, your periodic meetings, talk about what you can do to make sure everybody's seen on time. Things that can damage your reputation. Poor communication, always number 1, poor communication. Not doing exactly what she asks you to do. And that happened to me. I'll give you the example in my case. It was years ago, actually it was 8 years ago before I opened my first practice. Mom came to me and she requested that once her daughter, she was like probably 8 years old, she wanted her daughter to have sealants with nitrous. So scheduled for nitrous. I started working on the child, and before I did the nitrous, I looked at her. She looked like she's doing fine. I said, "Let me be the hero here and do it without nitrous." So I thought I'm doing something great, So I did the sealants. She wanted a little bit. I did the sealants without the nitrous, and the mom somehow she wasn't. Either she thought I was doing nitrous, or either she wasn't paying attention. And when we finished, she said, "I said, oh, we did the sealants. She did good. She was okay. She was a little uncomfortable. She did great." And she said, "Did you use the nitrous?" I said, "No." I said, "Excuse me? You didn't use the nitrous on it? Are you kidding me? I was expecting my daughter to be comfortable using gas, and you told me to use. She flipped out on me because I didn't know exactly what she asked me to do. That was my mistake. I should have told her, listen, Mrs. Jones, your daughter looks like she can do it well. Would you like me to try without nitrous? That was my fault. So you have to do exactly what they want you to do. You think you're doing something better, to them it's worse. So that's one mistake that I learned. Now, proceeding while her child is crying, again, back to without asking her. I made that mistake again. I was working on a child. She's numb, 100% numb. I even sometimes, just to give the parent the benefit of the doubt and eliminate whatever doubt they have, if the child is crying and looks like the parent looks like they think they're in pain, I go pick up the syringe and I can inject a little bit, and they know they're not feeling it because they're already numb. I inject them so they can think that I did my best to give them extra local anesthetic. They still could cry, so I kept going because I had to finish the procedure. I was in the middle. I had the matrix band, I had 2 MMO DOs, and I had to finish. So, and she was crying. I finished, and she said, and the mom didn't say anything the whole time. When I finished and stopped, she was like, why didn't you stop while she was crying? If it was my doctor, he would have stopped and come and told me to come back later and finish the procedure. So in her world, I completely ignored her daughter's concerns and crying, and I proceeded to hurt her. So after that incident, what I do is if the child is crying, if the parent is in the room with me, I said to them, I'm sorry, looks like she's crying. I gave her more anesthetic. I'm pretty sure she's numb. She's a little bit anxious. Would you like me to proceed? Or is that okay with you if I finish? If she says, at least I got her consent. I'm ready to go. I don't have any problem at the end. If she says no, then I try to wrap it up, stick Fuji-9 here, patch it with Fuji-9, let her go, and then sedation or general anesthesia, end of story. So that's what I learned from that lesson. Allow your mood to be discoverable, just like a Wi-Fi is discoverable. If you're having a bad day and you're distracted, then that could affect you without you even knowing. So you have to really put that smiley face on yourself and try to not let people know that you're having a bad day. Because it happened to me one time, again, that's my mistake. I learned it from my mistake. Something was distracting me. I had something, I don't even remember what it was, but something that irrelevant to work that was complete. I was thinking about it, I'm completely distracted. So finished the procedure, whatever I did, the parent requested record transfer. And the reason why is because I asked the doctor a question, he ignored me completely. And I don't even, for the life of me, I don't even remember if she asked me a question. But apparently I believe her, she must have asked me. I must have been so absent-minded that I didn't pay attention to her question, and to her, I was ignoring her. She decided to leave. So don't do that to yourself. If you're having a bad day, don't make it obvious. Do your best to put a smile on your face and just keep going. Now I think I mastered that thing now, that art of making myself look happy while I'm not. Next thing is things that could be deadly to your practice, silver bullets that we talked about. Number one, poor communication again. Poor communication. Confrontations, whatever you do, do not even, I'm sorry, it may be a matter of pride, and you just put your pride on the back burner. Do not confront the patient. I worked as an associate before, part-time, 10 years ago with a practice where they have almost on daily basis, literally a confrontation with a parent. And that practice really went down the drains. I saw how literally saw how they completely declined and damaged their whole practice completely. So that's a very bad thing to do. The only one confrontation I had in the past 10 years was probably a few years back ago, and only one. I do not confront patients anymore, whether it's my fault, their fault, whoever's fault. Never confront anybody. Outdated behavior management techniques, which we'll talk about right here. And now, those behavior management techniques are being taught in dental schools. I don't know. I've done my residency over 20 years ago. I don't know if they're being still taught right now, but they're part of the curriculum of behavior management. I don't know if you guys are doing them, but whatever you do, here they are. They're completely outdated. Whatever you do, don't even go near those things here. Number one, hand over mouth. Everybody agrees that's in today's world. No parent would accept that you put the hand over mouth and tell them to shut up. That's completely out of the question. Voice control. It used to be a thing before, and I've done it before, made my mistake, learned my lesson again. Voice control. You tell the parent, which is changing the tone of your voice to assert authority on a child so it can change their behavior and modify the behavior. That's what the defined is. It may work, yes, it may work, but how is it going to backfire and hurt your practice? That's what it's a lot worse than what you can accomplish. And for voice control, my story with voice control is two things will happen. First of all, we try to, when I used to do it before many years ago, I would tell the parents, listen, I'm going to raise my voice on your child. I don't want you to think that I'm angry. It's just a form of behavior management technique, just so it can get their attention. Like, okay. So we go ahead and do the voice control. So one or two things, even though you said that in the beginning, if the parent is in the room and she or he saw you raising your voice on their child, they say that you're yelling at my kid. I don't want you to yell at my kid. The second thing, the parent is not home. I mean, he's not in the room with you, and they're waiting outside. The kid will go out and say, the doctor was mean to me. It was so mean to me. So one of the two things will happen, and that did happen on a review actually. That they left a review when the mom said, and that's the second review that I had to remove, by the way, the bad review. The mom, I took my child to Dr. Ed Libby, and first of all, they made me leave the room, and which I don't think we did, because we have a policy of allowing the parent to come in if they want to. And when my daughter came out, he was so mean to her, and he scared her so much because I raised my voice, used voice control. So using the word mean, managed to contact Yahoo, because it was on Yahoo. I contacted Yahoo and told them this is defamation to the doctor, so they removed the review from me. I didn't even know who that. I don't remember the name of that patient. So voice control, please take it out of your dictionary. Papoose board, completely out of the question. I mean, it's being practiced right now. There are a lot of practices that use it. We don't have it. It doesn't even exist in our practice. As far as the parent is concerned, you're strapping their kid, you're working against, I mean, imagine you as an adult. I mean, I wouldn't do it to my kids, to be honest with you. It's not, forget about how it's going to influence my practice, but if I'm an adult and somebody is restraining me against my will and violating my oral cavity, I mean, I will be traumatized for life, let alone a growing child. You don't want to do that to anybody's kid. So that's completely out of the question. General anesthesia, end of story. Parent operating, same thing here. There was a time when it was thought that you can't let the parent do operating. Right now, no parent is willing to do that. No parent is willing to accept to wait outside and let their kid. And some of them do it. Very few that actually stay in the waiting room and they let their child come in, which is very nice. It's great if they can do it. It helps, many times helps. Some of them even say, "Oh, my child will do better without me. I'm going to wait outside." So that works. That's great. Some people are mature like that. It's wonderful. But most of them are not. They don't want that to happen. And so what we do is we allow all the parents to come in if they want to. Believe it or not, we have a problem not letting the siblings in. We have a big sign on every operatory that says no siblings are around in the treatment room, yet we have parents, mothers who insist on having a sibling. We say, there's a big sign on the front door, and we say it's better for you, the sake of your own child, not to watch what's going on, especially doing extraction or using an injection or something. You don't want your other little child. I don't have a babysitter, and I can't leave my kid alone. So we have to deal with that too. I mean, not alone. I mean, we have to deal with allowing the sibling into the procedure room, let alone the parents. So that's also a no-no. If you this what's going to happen to you is if you try to convince, because we did that in the past. I used to say, "Oh, it's been shown by research that kids do better when the parent is not with them in the room." Sedation. So sedation, and everybody knows that you have to have a permit if you want to do sedation. So you may be able to prescribe 5 milligrams of Valium. It's within your license. You're able as a dentist to prescribe maybe 5 milligrams of Valium to a patient, but you cannot use it for purpose of sedation in your practice because you have to have the sedation permit by the state of Connecticut. You do that, you prescribe an oral premedication agent, whether it is Valium, Versed, whatever it is, and you try to treat a patient, adult or child, and you get caught, you are in big trouble. So make sure if you want to do sedation, get a permit. It's a process. Yes, sir.
Can we back up just for the management techniques that you had before?
Sure.
Vis-a-vis parents in the operatory, do you find it advisable to coach the parents beforehand, such as I find it helpful to say, look, I've got to be the quarterback here. So if I say things to your kid like, if you don't behave, I'm gonna have to ask mom and dad to leave the room, would you please be okay with that? And I find that that is very, very helpful. I also find it helpful that if I diagnose caries in a kid, I tell the parent, don't say anything to your child. Don't say
Yeah.
anything about what's going to be done.
Absolutely.
Just bring them in
Yes.
and let me do the tell, show, do.
I completely agree. That's great. Actually, that's very good. I'm glad you brought that up. I would completely agree with what you're saying, and I do it myself. We even have it in the new patients form. When they sign, when they enter the new information, we tell them, don't tell your child he's getting a shot. We have that in caps. Please minimize your preparation. A lot of them over-prepare their child. So you're absolutely right. And if you have the time to do that, yeah, by all means. As far as we do threaten, so to speak, the child that if you are not doing well, we're going to have to ask mommy to leave. And we ask her if it's okay with you. Most of the times, they don't want to leave. When the mom sees her child is crying, and we're telling them now, it looks like you're crying, John, you're gonna have, mommy's gonna have to leave. No. And mommy's not gonna leave. She won't leave. I don't know if that's how it happened in my case, but maybe once 1 out of 10 that would actually proceed and leave, but most of them, secretly, they want to stay even more. So it may work a little bit to kind of threaten the child. I don't know how effective it is. To be honest with you,
It's actually the parents have to be on board with that. Parents have to be.
If they're willing to do that, but what happens is when they see a kid's child cry, they most of the time they want to stay more. They want to they like have 1 foot at the door and 1 foot by the chair, and they usually don't want to leave. And if you try to pressure them, that's a gray area where I would want to tell them, you said you're gonna leave. Now please leave. I wouldn't say that to them now at that point, because that could backfire on you. A lot of them want to stay by the door, and that's, I'm talking about previous experience when I used to insist on having the parent. I don't do that anymore. I learned my lesson. I've done it for years, many years. I used to ask the parent to leave and wait outside, and many of them used to stand by the door, close the door, and make sure they're like that. Make sure you're not killing their kid.
That's okay with me as long as the kid doesn't see that mom or dad.
Yeah.
I don't tell them to go all the way down the hall.
Yeah. You're right. As long as the child doesn't see it. But I'm telling you, when you see reluctance from the mom, if the parent, the mother is reluctant to leave, I wouldn't push it. I wouldn't tell her, you told us you're going to leave. Please let's leave. I would just wrap up and either sedation or refer or something. The last thing you don't want to do is pressure the mom to leave and then having her think that you made her leave, like that lady who put the poor review on. He made me leave, and then he was so mean to my child. So again, we need to know that. In case you don't know, it was a time years ago when I found that actually accidentally. I didn't even know myself. I found that we had to have a sedation permit. So even as pediatric dentists, we have to have that. So please make sure you have that if you do sedation.
Even for nitrous, do we need?
No, nitrous, no, not for nitrous, right? Nitrous, I thought, in the beginning I thought it was nitrous, and figured out that it's not necessary. If you combine nitrous with anything else, or even you do nitrous, you use just Valium, you have to have a permit for that, because you have the pulse ox, you have to have no monitoring standards, and a lot of things that they have to examine you on, and they have to observe you to a couple of cases before they give you the permit. Now, talking about writing notes and excellence in writing notes, your notes are your castle that will protect you from a lot of things. That's your only protection. What happened during a visit is not what you think happened or say happened or you tell the judge happened. It's what has been documented in the notes. That's what really happened. So that's why we have to pay extra, super attention to the notes. I'll just highlight some things that a lot of things I may not be able to cover, but a lot of things that may apply to you as general dentists are a little different. But I will highlight some of the important things here. The thing that you have to keep in mind, and that's how I did it myself when I write my notes. When I type my notes, am I typing them as Dr. Ed Libby for myself? Am I typing my notes? You are not, but the key is you're not typing notes for yourself. You have to take 3 or now 4 personalities and be in their shoes as you're typing the notes, and think that you're the judge, you're the parent's lawyer, you're the other dentist who can tell them that you did a bad job on their teeth, because you want the dentist to make sure he's reading your notes too. And now we have this big problem that we just came up with, the Medicaid auditor who's not even a dentist. This is something very recent. You probably heard about that. So that's something to be super careful about. So you are for all those 4 people when you type your notes. And that's the only way you can make sure that you're typing your notes properly. So you can't when you have to think that this judge is reading my notes, you can say, Your Honor, I didn't know that this is supposed to be a crown. I did a fourth surface amalgam on it and it failed and I didn't diagnose it. It has to be all documented. Nobody's going to take your word for it. They'll take what you have typed there. You would picture yourself the other lawyer who's trying to figure what you have done wrong with the notes, and you want to make sure that you are proof to that. You're the other dentist, because picture yourself another dentist reading your notes also. So you want to use both. You have to make a balance between using the simple terms that have been conveyed to the patient, along with using the scientific terms that the other dentist will read when you type your notes. And obviously here, this is the hard one that we just recently, I have to actually really dramatically change the way I type notes after I found this here, and I will talk about that. And that's what we'll solidly talk about at the end, my office manager. The Medicaid auditor is not a dentist. So as far as he or she is concerned, you type, I did MO composite on tooth number 19. Number 19, MO composite was done, etched and bonded, and MO composite was done. As far as he or she is concerned, you did a composite, you drilled a virgin tooth that had no cavity in it. So they want you to say that tooth number 19 had a simple caries on a mesial surface and an MO composite was done. So if you don't type that, you're in big trouble. They're going to come and they're going to penalize you and make you pay back. And I don't know how the system works out, I will tell you. They make you pay back. I know one of them in New Haven that was other than they made him pay. Actually, I don't know if he's going to pay that much money, $700,000. $700,000 for Husky alone because of this auditing system. So be careful now. We'll talk more about that as we go also.
Was he just not, he wouldn't diagnose it, he wouldn't put it down?
No, he just didn't type it. He did. The guy is a good pediatric dentist, by the way, not even general dentist. A very ethical person, good clinician. He didn't do anything wrong. It was no fraud involved here, by the way. Just mistyping, not typing the proper notes. So we'll talk more about that. So a lot more details into that. Bulletproof notes. That's what you want to try to aim for. Nobody can penetrate your notes. No judge, no other lawyer, no other dentist that's going to hate you, and no Medicaid auditor now, which is the biggest problem at this point. So, got consent. Number one, consent. Number two, consent. Number three, consent. So that's the number one thing that the other lawyer, the parents, the patient's lawyer who's going to sue you will go for. My brother-in-law is a pediatric GI specialist, practices in Seattle, and he had a patient who was terminally ill, a child who was terminally ill, unfortunately, and I think he was out on vacation. The patient was seen by his associate, and he had a procedure, a surgical procedure done in an emergency manner, and the child passed away, unfortunately. My brother-in-law got sued, not for negligence, not for malpractice, for the consent. So, and that's what the lawyer thought, that this was the best way to get him and to get his money, and is by going and digging into his consent, make sure that did he convey the appropriate procedures, what has been done, what is needed to be done, what the risks are, properly to the parent or not. And he knew this is his best shot of getting him by going after his consent. So we need to know, number one is consent, and be very, very knowledgeable and well-versed about what consent is. Now, there's a study done by the National Institute of Health, and they have identified this, as published on PubMed, you'll find that study. They identified the 3 areas of legal vulnerability for dentists. And number one is absence of consent to care, or not obtaining a proper consent. Number 2 is negligence. Number 3, the breach of contract. Now, negligence is something like misdiagnosing, failure to diagnose, doing the wrong thing. Breach of contract is an example that if you have a patient that comes to you and their expectation is their chief complaint is they have tooth number 3 is hurting him, and you treat tooth number 14 instead, and you don't eliminate the pain that they came here for, you breach their contract, because their contract with them is that I came here because I have no tooth number 3 that's hurting me, and you treated something else. So breaching the contract in this way is also you get penalized. That's why we do the chief complaint. That's why we document as we taught at dental school, we document chief complaint, we document what we did and what was done, and that we addressed the patient's chief complaint. That's important, that because we met or we did not breach the contract. We addressed the. So this is one thing that I got actually from the APD, or that's not from me. That's from the APD guidelines. Consent to care, to be valid, must be informed and granted voluntarily. To meet the test of informed, the information given to the patient must be in understandable language. So you can't say an MOD composite restoration. You have to say a resurface filling. You can't say a crown. You can say a cap maybe, or something like that. You know what the difference is. And so their language can contain the risk, benefit, and alternative to the recommended treatment. Now, when it comes to the informed consent, the word informed is a key. There's something called express consent, implied consent. Implied consent is the fact that they came into your appointment. Obviously, that indicates they're consenting to that, you treating them. So, but that's only a branch of the informed consent, or actually it encompasses all the other ones. If you have the informed consent, which means you've done this, then you're fine. And we'll talk about how we do that when it comes and how it applies to us when we treat children or even adults. In addition, the patient must be given an opportunity to have his or her questions answered. Very key, very important, and we'll talk about that in a minute. Obtaining consent from one having legal capacity to grant consent, all that. So there's a difference, by the way, just so you don't get too scared. There's a difference between doing an invasive procedure, like a surgery, like in our case, OR cases, when we do full oral rehabilitation, we do like 8 crowns, 5 fillings, 3 extractions, and 2 space maintainers on one child. That's like an invasive surgery considered. That's classified and that's different. That's, you have everything documented in writing, the risks, the benefits. We do that at CCMC. Everything has a space for it. They have to initial each one of them. They have to sign. So that's one thing. But when you do a simple procedure, like a restorative procedure, there's a lot more leniency in there, which can include just verbal consent being documented, not necessarily written as it is when it's invasive. If you have a consent to treat a patient, no consent whatsoever, you could be charged for criminal battery, because you actually, as far as I can see, you attacked the patient with a high-speed rotary instrument without their permission. So you don't want that, obviously. APD, American Academy of Pediatric Dentistry guidelines. Consent forms, and I'm not talking about forms, more practical. You guys are having forms, you have forms in your offices. Consent forms should be procedure-specific, utilize simple terms, and avoid overly broad statements. If you have this on your consent forms, please take it out. Any or all treatment deemed necessary, all treatment which the doctor or her assistant medical judgment seems necessary, including and not limited to, this will hurt you in court. And that's according to the APD, that's not according to me, APD guidelines. Don't put broader terms in your consent forms when your new patient's form, when they sign. Try to do things specific. We have every patient who comes in for any procedure, MO composite, extraction, sensory crown, whatever it is, you name it. We print the treatment plan, they sign it, right? They sign it, we scan it, we put it in their chart. And we do that for every appointment. So everything is signed, they consent to this work, there's no exceptions. Specific, very specific. APD guidelines, I mean, I wish I should have probably printed that for you, but if anybody, my email, by the way, I'll give it to you at the end. You can email me if you have any questions. It's on the, and I don't know if you guys have business card, my business card in there. You can email me any questions about these. I can email you this thing, for example, this slide. Basically, APD, American Academy of Pediatric Dentistry guidelines, when a practitioner utilizes an informed consent form, the following should be included: name and date of birth, name and relation to the patient, all that, description of the procedure, disclosure. You have to make sure that all these are there. Now, if someone who is not the legal guardian, not the parent, bringing the child, so let's say you have the babysitter, the nanny, the grandmother, or someone else, the neighbor, whatever, brought the child, do not work on them unless you have a signed consent, or at least a verbal consent that you can document with a witness over the phone. Whatever you do, I don't care if you're going to lose a whole hour worth of work, just don't touch that patient unless you have a consent from the actual guardian. Because that's the one thing that you want to be careful about, is consent, number one. Now, who's likely to sue you? The one who is mad at you, who is irate. That's the one who's likely to sue you. The IPC, identify potential complainers. So when you are able to The number one, and I heard that from a practice management seminar years ago, and I believe in it wholeheartedly. The ones that you're able to pacify and eliminate their anger against you, or their feud or their hatred towards you, they're not going to sue you. The only ones who are going to pursue you or complain about you or sue you are the ones who are mad at you, who hate you, have something against you, personally, professionally, whatever it is. So someone who likes you is not going to sue you, most likely, even if they think that you did something wrong with them. And we'll talk about that, how we can do things to actually transfer or transform a patient from having something against you into either pacifying them or making them happy. That's the way to handle complainers. You put an exit sign before your office, and then we are on exit 38, we can put it on exit 37, and then they'll take the exit and go somewhere else if we can help it, but we can't do that. We have another way of doing it. We have that in our office in Bristol. We have this. This is actually from our office in Bristol. So if they want to have a complaint, they can just take a number and stand in line. You don't want to blow them up, just a joke. All right, see, the skeptic patient. And I will talk skeptic patient who can turn into a patient who wants to complain about you or sue you, or I will talk about both kinds of patients, how to deal with them. Someone who is in doubt of what you're doing, be it an adult or a child, and that happens, and I'm sure every one of us experienced that. You get someone who's telling you, are you sure? The hygienist told me it was only 3 cavities. Why are you telling me there are 5 now? I mean, you have that kind of accusing tone. And as soon as I hear that, I'm like, I want to find a way to get you out of my practice somehow. Oh, doctor, I thought we could do a crown. I heard that you could do a filling instead of a crown, and you don't need to do that. And then some people, and are you sure this is that? And you could sense in their tone that you're almost accusing you of trying to do more so you can make more money. That kind of patient, with all due respect, I don't know what your strategy is. I want them out of my office one way or another. You have a huge advantage over. You're a general dentist. You can tell them, go to a specialist, not me, please don't send them to me. I mean, that's if they're kids. Send them to the other pediatric dentist. But if an adult who wants a crown and you're having doubts about what you do, so there's a prosthodontist down the street that I know is very good. I think your case needs a specialist attention because it's a little bit more complicated beyond my scope, and I think you can benefit from a specialist, and you can word it in a way that you do it for her own best interest. And you don't want that. I mean, you get the feelings in your stomach that there's something wrong with that patient, that's the patient you can't please, you can't make them happy, and you really want them out. I mean, that's my opinion, that's my strategy. You could do whatever you want, but that's my advice to you. Now, with skeptic patient, you have to take super extra precautions when you document things on top of your already bulletproof notes. Number one, because they're going to ask you, they're going to argue with you as if they know better about dentistry than you are in some cases. So you want to document your recommendation and why. I recommended a crown for that patient. You document your recommendation of second opinion. The first thing, and every time I have a patient who's have this accusing tone of doubting what I'm saying to them, this is Mrs. Jones. I would encourage you to seek a second opinion in this case. I know it's always good to have someone else look at your child, and I'm not offended. I say it in a nice way, pleasant way. I don't want you to think I'm offended with you. It's completely fine. I understand. In some cases, some people you feel probably more comfortable if you hear it from another source that this is what your child needs. And many times the first thing they say, "Oh, I'm not doubting you, doctor." Somehow you kind of take them to a different level of somehow they remove that doubt, that they know that you are actually encouraging them to seek a second opinion, and you have to document that. That will help you to protect you in case something goes wrong. So you document second opinion was encouraged, and in a nice way, obviously, tell them that it's for your own benefit, and you document the options, the risks versus the benefits, obviously, which is back to the informed consent. Now you have that documented in writing, that we give her the options, we give her the risks. That, for example, no, I don't want this to be treated. I want to wait till next year because I think it's going to fall off anyway. We mention the options and the risk of no treatment, which will include an abscess, a cellulitis, spread of infection, whatever was stated to the parent, and the benefit of treatment. That is documented. Document the choice that if they chose to do something against your recommendation, let's say you're in the middle of a procedure, you can't back up, whatever the situation is, you're in a position where you can't back up, and they want you to do it their way, and you have no choice, you're stuck, whatever the reason was, and they made you do a filling instead of a crown, then you document that. The parent chose to do a filling against my recommendation, so this way that nobody can charge you with negligence because you did the wrong thing, or you misdiagnosed, or you did something that does not meet the standards of care. So in this case, you are protected because they are the ones who made the choice against your recommendation. Now, use the written consent format that we talked about here. Now, rather than verbal and saying obtain verbal, or just saying what you discussed verbally with the parent, if you can get things in writing at that point with that kind of patient, do it. If you have to proceed with whatever. That's a very important thing that I actually learned recently from my associate. And that was going back to the other slide. Questions. If one of the things about the consent that was mentioned previously, the informed consent, is that you give them the space to answer any questions they have. If they have questions that you did not address, you breach the consent and you breach the contract with them. So at the end of every consultation, emergency visit, new patient visit, a skeptic patient of that nature, put at the end the patient or the parent left with no further questions. She had no further questions upon dismissal, no further questions upon leaving. Very important to help protect yourself. Documentation, I don't know if you know this, but insurance companies may request narratives after a claim has been paid last year, a year from now. They can tell you, I want a narrative about this crown that you did on number 3. And if they find that something is missing with not accurately describing the reason why you did the crown, for example, you can be asked to pay back or other penalties or being reported or something. Now, this is a nice example. If you're doing a crown, you have to state this. If you're doing a crown on a tooth because it has an existing filling, and let's say it's not even visible on the radiograph. There's nothing striking about the radiograph that shows that this tooth needs crown. So you have to mention things like that. Cups of tooth were undermined and weakened, or fracture cast needed to be restored with a crown. Recurrent caries may not be even visible on the X-ray. Trauma. Now that is, even if it was visible on the X-ray when we're dealing with a Medicaid auditor, you have to have this, even if it's visible, because they don't know how to read X-rays. And as far as they're concerned, you did a crown on a tooth that it wasn't needed. It didn't need a crown. Now it has to be shown, should clearly describe any injury when there's a trauma, obviously. You should clearly describe in detail the type of trauma, the angle, the incisal edge was completely fractured, the tooth, whatever the situation is, so you can justify doing the crown. And if you are not doing, if you don't have to consider that now they're very cheap, that will help you take one snapshot of the tooth, save it in the file. You have that as a backup in case somebody questions you. When it comes to pediatric crowns, we're talking about stainless steel crowns for kids. This is what you need to write, and that will for everything, especially the Medicaid auditor. Tooth K, and regardless of the X-ray showing that there's a huge caries, doesn't matter. This is just regardless of that. This has to be written on every child you do a crown on. Tooth K had advanced caries and it was restored sensitive crown, middle glass aneurysm cement. You have advanced caries here, so you're protected. If it didn't have advanced caries and is not showing on the X-ray, but you have multi-caries, like MOD. We don't do MOD, by the way, most of the time. Sometimes we do, but most of the time we don't do MOD. We do a crown. Tooth K had multi-surface caries, existing restoration had already an occlusal, cervical decalcifications, and therefore it was restored with a sensitive crown, middle glass aneurysm cement. And make sure you also have poor oral hygiene documented if you have, because the reason obviously why they have decalcification is because they have poor oral hygiene. So now that's another added reason why you did a crown on a tooth that looked on the X-ray that only had 2 little MOs or DO on the radiograph, on the bite wings. Obviously what you want to document here, again going back to bulletproof notes, what patients presented for, chief complaint, you addressed that when you treated him or her, treatment rendered which addressed the chief complaint, amount of local anesthetic used, lip biting caution, and a lot of people don't write that, especially general dentists. You want to make sure, because a lot of parents may think that you hurt the child. It happened to me one time years ago. I had a parent who thought that I actually cut the child's lip with a handpiece. They really firmly believed that. They went to another general dentist, and the dentist, and I read the notes that came from the dentist, and dentist put a patient presented with a big lip with lacerations and necrotic tissue, and differential diagnosis: number 1, allergic reaction; number 2, blah blah blah. I forgot what a whole list of things, and none of them was biting lip. None of them was even trauma. So when a child bites their lip, it gets so nasty and it's scary looking. It's big and swollen and painful and has a whitish stuff on it, and it's, for the parent, this is a huge thing, you know. So if it's documented, no matter how you do, sometimes they're just gonna bite it anyway. So make sure it's documented there. Type of dental materials used. You may wonder, why is it important? And I'll tell you why. One incident happened to us. Believe it or not, we had a 9-year-old girl patient that we did a sealants on, and the girl, she had an allergic reaction to the sealant. She couldn't even breathe. We had to rush her to the emergency room. She was able to maintain a certain level amount of breathing, and she did not faint. She didn't lose consciousness. She went there. They put her on prednisone. The ER contacted us to say, take out those sealants out of her mouth. And we don't know what the heck was in those sealants. There was no like a peanut tree or anything like that of that nature. She was not allergic to things that we know of. So if you document something that you know that has an allergen, that you are aware that the patient is allergic to that, and you use it anyway, that could be against you somehow. But at least you know that you've done your job. You know that your material doesn't have the allergic thing that the allergens that can make the patient allergic to. Complications, obviously, options given if applicable. Like we said before, behavior, cooperative and uncooperative is important. By the way, when it comes to behavior, one of the things that will help you protect yourself, what I do personally, sometimes I'm doing a quick, like I said, a quick 5 minutes or 3 minutes occlusal on K with a Fuji 9 while the kid is screaming in his mom's lap, right? I document procedure was done in very difficult conditions due to patient's behavior. This way, if another dentist see a less than perfect film, they don't think I'm a sloppy dentist. They'll know that when they read the notes, that the patient was screaming and kicking, and it was done in very difficult circumstances. So therefore, that's another thing that it's good to always write. And in case something happens, somebody question you what you've done, or recurrent cases or something not perfect, then at least you have that document that you did in a very difficult condition, that the child was very uncooperative for whatever reason. So this is a note from actual patient from one of my records. I just copied it and pasted it here, just to give you an example of what we do here. Patient present for restorative treatment on tooth H. Hygienist, the examining dentist who examined her, one of my associates, also verified that this tooth H needs a filling. I re-examined the patient, determined that tooth H is blocking direction of tooth number 10 due to anterior crowning. One anterior PA was taken to confirm diagnosis. Explained to father that the extraction of tooth H is indicated to provide space for tooth number 10, and the contralateral tooth C needs to be extracted to prevent midline shift. Explain everything, right? Father understood and consented to extractions, reviewed medical history, obtained consent from father to treat and to extract tooth C and H, used this much articaine. Simple extraction were done, gauze pressure applied, instructions given, tooth impression for the NANS. Next visit, deliver NANS. Another one, patient presented for restorative treatment and extraction. One PA radiograph was taken for tooth T. If you write one PA radiograph was taken and you leave it at this, the Medicaid auditor will penalize you, will make you pay it back and pay, I don't know how much back pay of PAs worth thousands of dollars, because they want three things. They want to know which tooth, if you take a PA, you want to document that you took a PA, they want to know which tooth you took it for, because when you build it for a tooth, right? And they want to know why. So this is why. Taken for tooth T to detect focal radiolucency, which was present here. Review medical history, obtain consent from guardian to treat, use this much lidocaine. Inferior life, local infiltration. Number 314 had incipient caries with the PRRs on those. Prep H bonded and filled with flowable composite. J had simple caries and was restored to surface. O bond resin composite because it had simple caries. That's the reason why, not because it was a virgin tooth like what the other would think. 19 had simple, this and that. We did the extractions. I used the type of material. I took the impression for a lower lingual arch. Next time, lip biting caution was given. Behavior cooperative next to delivered lingual arch. Just a quick example. Now, I hope this doesn't insult anyone. Clinical keys to acting as a specialist. You need to act as a specialist because and I'm sure a lot of you know that, if you get in trouble, you do something wrong, you are held to the standard of a specialist. If you do an extraction, a surgical extraction on an adult patient, and you mess up with something, you cannot defend yourself and say, I'm just a general dentist. An oral surgeon would have done it in a better way because you are held to the standards of an oral surgeon. This is something we need to all know. This is something we're taught in dental school. So you are held accountable to the standards of a specialist. The same thing with kids. You treat a child, you are held to the standards of a specialist with a pediatric dentist. So those are the keys. I thought I kind of brainstormed and squeezed my thought, and I came up with 9 things that I literally experienced with my 20 years of work. The 9 most common GP mistakes in pedo, and you guys can avoid them. Number 1, doing a multi-surface filling instead of Sensi crown. Very, very common. I see so many kids come into my office with MODB on some K-tooth kid that failed. Obviously, inevitably, he's going to fail unless you're really lucky and stayed until the tooth falls off. And then I have to fix that, obviously. And number 1, and we all get these things all the time, and you have no idea how hard I work to defend the dentist that did the work. That's like number 1 thing that, and sometimes I get, I know you're trying to defend your colleague, but can you please tell me they did that wrong? And I say, no, this is Mrs. Jones, they did what they could have done in those circumstances. There was probably recurrent caries that happened here, and that's very common. Recurrent caries is common. That's why I'm trying to do crown now. So things like that, sometimes there was one time that I ran out of defense for the dentist who did the job. Actually, it was not a job that was done. And I'll never forget that. They come to me, did the dentist miss it to diagnose? Did the dentist did not detect this cavity or this and that? And that my other dentist and I'll say, no, Mrs. Jones, it probably was too small. It's very easy to miss. Now we can see it and all those things. So one time I get this parent that had 8 cavities. They need like 8 crowns, and they're all interproximal. They were visible even without bite wings. And they were with the other dentist 6 months ago. And now how do you defend that? So I told her, she said, did the other dentist see those cavities from before? Now, I don't think they could have seen them if they didn't take bite wing X-rays, because those are usually hidden and they don't become apparent. They don't become obvious until they break out and they become so obvious and get to the point they have to do crowns. But I know they took X-rays 6 months ago, so they must have been there. And I say, I don't know. I really have to look at the X-rays to tell you. What else can you do? So she goes to the other dentist, gets a copy of the X-rays and comes to me. And she says, do you see cavities here? I look like I do, and there are cavities here. So we're going to decide. So she went back to the dentist and she gave them hell. My kid was there 6 months ago. He was even a pediatric dentist, even a general dentist. He had those interproximal caries. You didn't do anything about them. Now he needs crowns. I don't know what you did with the other dentist, but I did my job. I did my best to avoid getting him in trouble, I swear. But sometimes things like that you can't avoid. But that was one incident I'll never forget. Anyway, going back to the second one is leaving gross caries under a filling to avoid the pulpotomy or due to behavior. I see that so often. I see kids coming with like a patch-up work with lots of decay that is even visible on bite wings, because the dentist felt that if they excavate more, they're going to end up with a pulp exposure. They don't do a pulpotomy, they avoid the pulpotomy, or that child was uncooperative. And they tell the parent that we did the filling and they charge the filling. It's end of story. You can't do that, obviously, because you can end up either with an abscess that could come back and haunt you. I personally always find, like I said, I always find a way to protect my colleagues. It's part of my ethical standards, but I don't know who you can end up with. And speaking of which, unfortunately, not everybody has those ethical standards. The only one time where I got close to being sued was about 7 years ago, and it was because of another dentist, believe it or not. And the way it started, I had a 4-year-old child that needed an OR. I did crowns, several crowns. Among them were 4 anterior crowns. I took PA and the OR, and they were complete roots. It looks like they're not going to fall for at least 2 more years, or 3 more years at least. So you're going to kill until like 6 or 7. And they saw no extraction. Did 4 anterior crowns. The year after, somehow the teeth fell off early. They exfoliated early for whatever reason, even though they had full roots on the X-ray. They went to another dentist. They said, we paid this much money for those crowns. Dr. Elibi did this work. And he told them, this is what you need to do. Go to the Department of Public Health. And that's what the parent, go and file a complaint against him. And the next thing I get, a letter from the Department of Public Health. That's the only one complaint I got against me, saying, turn in the records for this and such, but we can't tell you what it's about until you do it first. And that is enough to, it's very nerve-wracking. I don't know if it happened to any of you, but it's not a nice letter, not something you want to go through. So I sent the notes, because they don't want you to alter the notes, obviously, send everything, and then after they receive everything and the x-rays, then they tell you what the complaint was about. So I got the complaint, oh, this is where you did those crowns, the tooth were gonna fall off anyway, within a year they fall off, you didn't do a job, or you fell behind the standards, whatever the complaint is. Tell us your story. So I wrote a 2-page letter explaining everything to them. I did the crowns in good faith. They have long roots. You can see them on the x-ray. Nobody can dispute that. The lady spoke to me on the phone from the Department of Public Health. We're going to show what you have written, the records, the x-rays, to another pediatric dentist that lives really far away from you, practices like off the shoreline somewhere away from you, and we'll get back to you. 6 months later, thank God it's unsubstantiated, and the other pediatric dentist agreed with me, and the other, so nothing was filed against me, no. But the bottom line is, another dentist can decide that they want to do that to you, so you need to be careful. Not placing a space maintainer when indicated, I see very, very much so, and that's also a hard one to try to protect your colleague but many times I can get away. Actually, if not all the times, I manage to get away with it. They come in, they have already, as general dentist, took tooth A, didn't put a space maintainer, tooth 3 drifted forward, they lost space, now they need a space regainer or ortho. Now, try to explain to them, why did they lose space? Why did they need a space regainer? Because the other dentist didn't put a space maintainer. There's a way to do it. We tell them that it was not possible probably for the other dentist to put a space maintainer at that time. The tooth wasn't erupted. It was difficult conditions. Your child must have been young, so that happens quite often. So now it's not a big deal. We can fix it. So most of the time, usually we can proceed without harm. Nobody is interested in pursuing anything. Sealing over caries, I see that a lot. Also, you have a sealant with like tons of decay underneath. So you see caries. Either do a one surface composite, or do PRR. PRR is simple. You know what it is. Preventive restoration. You just go over the fissures with a fissurotomy burr or a quarter round burr, and then H-bond and seal with composite. Now we have a new code for that. A lot of insurance companies will pay for PRR, but it's unfortunately the same fee of the sealant. The only difference is that if you've already done a sealant, you can charge for PRR. If you've done a sealant, you can't charge for another sealant you already charged for. Compromise quality due to behavior. A child is crying, not cooperating. I've seen dentists do a patch-up work, patch on the buccal, patch on the linguals, patch here and there. Doesn't even look like a restoration, and they charge for service filling, and they tell the parent everything is all set. So that's another thing that I wouldn't do. I would tell the parent that I'm sorry, your child was uncooperating. I did my best that I could do. And it happened even to me as a specialist, as a pediatric dentist. That happened to me before. Listen, Mrs. Jones, I've done my best in this case. Your child didn't cooperate. I tried to do a procedure, but the conditions were not very favorable. I had to do the best I can. It's not really the kind of ideal thing that I like to see in his mouth, but that's the best we can do. Hopefully it will stay, hopefully it will stick, and usually I understand, you back to, if something happens, something goes wrong, the dentist already told me that he did his best, and charge it as sedative filling. Don't charge it as a full restoration, because that's also protect you. You've done a sedative filling, and nobody's going to hold you accountable for leaving decay on a sedative filling or not doing it perfectly because it's just a sedative filling. Prescribing antibiotics for localized abscess, very common. No need to prescribe. Actually, on our referral pads, I had that in red for that reason. No antibiotics are indicated for a localized abscess. If you have an abscess especially with a draining fistula, no facial swelling, do not prescribe. There's no need to prescribe antibiotics. Extract the tooth, end of story. You tell the parent, however, it's very important to tell the parent and document it that the patient has been advised that if they see a facial swelling, they should report immediately to us, and antibiotics should be prescribed. Now, if the localized abscess spread into a cellulitis, you have now facial swelling, then it becomes like an emergency. Now we have to prescribe antibiotics, but if it's not, then you don't need to. You can either do extraction yourself and eliminate, and some parents question you, are you sure it's an abscess, doctor, it's an infection, are you sure he doesn't need antibiotics? Yes, I am sure he doesn't need antibiotics. Once you extract the tooth, abscess will drain, no need for antibiotics, it's healed, it's finished, end of story. So no need to do that for a localized abscess. Not referring and not treating. Also very common, I've seen that. You see it as general dentist sees a child, they see some cavities there. Child, for whatever reason, they want to work on the child. Whether he's uncooperative, too young, they're not comfortable working on him or her, they don't refer him anywhere. Your next visit is 6 months from now. 6 months from now, they have big abscesses, big problems. They have no choice but to go to a specialist, and then let's see how the specialist is going to explain why he was 6 months ago with a dentist, with a general dentist, and they didn't do anything about it. So that happens a lot. He was 6 months ago at my dentist, and they didn't tell me anything. Now he told me he needs 8 crowns. So if you see something you can't treat for whatever reason, refer. Not taking bite wings, that's also very common. I get 6-year-old. They were at the general dentist 6 months ago. Nobody took bite wings on them. Now they also have big lesions needing crowns and a lot of work. So try to take bite wings. If you cannot take bite wings, document it. If the child is 5 at an age where he can tolerate bite wings, yet you couldn't take bite wings or you didn't want to take one, whatever reason, you have to document that. An attempt was made to take bite wings, but could not take bite wings due to a child's behavior, and then you're protected from, nobody is going to hold you liable for not taking bite wings and detecting what you should have detected. They're just baby teeth that fall off anyway. That's not as common, but I don't think any dentist would say that, but yet I still hear it from parents telling me, my dentist told me they're just baby teeth, they're gonna fall off anyway. So I don't think any of you guys would have this kind of attitude. More clinical keys to acting as a specialist. Now, again, you impress the parent a lot. You fascinate them even if they see that you are using those techniques. Simple, tells you to do techniques. Praise takes you a long way. Take bite wings or document that you couldn't. Sensory crowns instead of 3+ surfaces restorations. Extraction, put a space maintainer. Refer the very young or the uncooperative. Now, keys to crisis management, that's the last thing we're going to talk about here. The bottom line is you can't make everyone happy. No matter how perfect you are, you can't make anybody happy. If you have that, if you think that you're this ideal perfectionist, perfect dentist, that everybody should like you, then you're in for depression, because there are people who are going to hate you no matter how good you are. I mean, there are people who hate Shakespeare, there are people who hate Mozart, there's people who hate George Washington. No matter how good, accomplished, perfect you are, there are people who are not going to like you, and you have to, when you realize that, then you're not going to get upset. So the first thing, and you have an irate, angry patient or parent, first of all, do not react. Keep a flat face if you can. If they're calling on the phone, same thing, no reaction, no arguments, no confrontations. Put your pride on the back burner. Trust me, it's either your pride or your practice. Pick one. Either you have to get confrontational and tell them, no, it's your fault. You're the one who didn't pay your bills. You're not on time. You didn't follow instructions and have them badmouth you. What's going to happen is, even though it's their fault, it's 100% their fault. In their world, you're the bad, mean guy, and they're going to go and talk to everybody about how bad this dentist was, and they are striking you at where it hurts the most, your word of mouth factor. Now, I'd rather somebody spray graffiti on my billboard and I have to pay for a new one, rather than somebody hurting me and what more the more important part of my practice, which is word of mouth. So that's why I have to really be very protective of my reputation and my word of mouth effect, because that's my biggest source of referrals. You have basically this way, you have to shift to saving the reputation mode, basically from the defending mode to shift the gear into that mode. You should take. What I always start with them when I take the blame. Obviously, I don't admit guilt if they tell me you are a bad, mean guy, you've done this work that was not right, and I don't say, yeah, you're right, I did bad. No, I say, listen, Mrs. Jones, I understand your concern. That's how I always start. I understand your concern. I understand why you're upset. I would be upset if I were you. And it was a very poor communication on our part. We should have conveyed that to you and made it clear to you. So these things, although they don't happen very often in our practice, thank God, but they did happen. When they did happen, I'm going to give you an example, actually. The question is, if you can you change a person's perception about something? And the answer is yes. If you can, they let you, they give you a way in to enter their world. If they completely have barriers and they just don't want to listen, they want to talk, they want to converse with you, they have nothing to say, then obviously nothing you can do. But I'll give you an example. Again, I think learning by example is the best. In my case here, when I had, that was very recent, that was only like a few months ago, we had a patient that was seen by the orthodontist for, they had, first of all, that, just give you a background, that they have overdue balances, they are sent to collections. They do not, it was documented they had not shown up for appointments like multiple times. They're in ortho. Our orthodontist was treating them. They went there for multiple times, losing the expander. He had to recommend it multiple times. The mom called and spoke to the receptionist and say, I think you are a fraud company, you are terrible, you are trying to just make money. Every time we come here, you're charging our Delta, we're gonna call Delta and find out, we're gonna investigate. I mean, that lady was really, really, I mean, charging big time. I mean, not like anything I've ever heard. Called the lady, didn't even want to pick the phone, okay? So as far as I'm concerned, I mean, what else can I do? I wrote her a 2-page apology letter explaining everything. She said, my child came in, she came to the orthodontist. She heard him say that the retainer is not going to fit, but we're going to cement it anyway. So what kind of a doctor is that? All those kind of accusations. So didn't respond to the phone call. I sent her this letter, explained everything to her, apology, blah, blah. $200 check or $100 check involved and included, free treatment in the future, everything you name it. I want to protect myself. I mean, I'll do anything. I'm sorry, my office manager disagreed with me on that, but to me, it's an investment. It's not a loss. She called me back. A couple days after she received the letter. She said, thank you very much for the letter, I appreciate it. And I said, thank you for calling me back. I'll explain to you the situation. The reason why the orthodontist had, you're right, your daughter have heard that, but the reason why he had to cement it because he doesn't want to lose the space. Even though it doesn't fit properly, he had to leave it in there some way so she won't lose the space. He want to collapse the arch after he expanded it. And she said, oh, wow, I wish somebody explained it to me that way. I'm sorry. She said, I was in the process, she was in the process of collecting evidence when she told me, my brother is a pediatric neurologist, and I called him and he told me this, and that, and I started requesting documents from Delta, and I'm going to. She was in the process of collecting evidence. That lady was going to do something. So apparently, at the end, she was pacified. She was thanking me. She's going to bring her daughter back. She hung up the phone, happy. So I've done mission accomplished as far as I'm concerned. Now, yes, it was her fault. She was sent collection. She was not showing it. But as far as I'm concerned, I won. That money that I sent her, that I considered I gave her, I don't consider that as a loss. It's an investment as far as I'm concerned. I protected what I value the most, my reputation and my word of mouth, because the 200 people she's going to tell, they're not going to believe that she was it was her fault. They'll think it's my fault. I'm the bad, mean, evil guy. Because according to statistically speaking, every patient that goes out to badmouth you has the potential of making you lose 200 other patients. And again, I heard that from a practice management course years ago. I don't know how true it is, but that's what they say. You can change one's perception. I managed to do that. I was successful in doing that with that lady. Those are not a loss. This is an investment. That's how I look at it, and I don't regret it. I think we discussed everything. Thank you very much for taking the time and spending this seminar with me. I would like to, a couple things. First of all, before obviously, Salih's going to talk to you about the very important topic, like I said, the auditing system. The next course that we'd like to decide when is the best date for you. What are the choices that we have right now? Let's do it Wednesday the 11th at 6 o'clock. We'll send you all emails and letters and confirmation and calls like we did with the pestered you with all the calls. I told my, by the way, in case, I'm sorry, I hope you don't mind, but I told Katie, my receptionist, please treat those doctors like you are confirming patients. So we want to make sure that they're coming. You call them, you send an email and all that. So I hope it wasn't too much. What we do with our patients, how we minimize our no-show rate. We call them, we text them, we pester them, and that works for them. Now we're going to try to learn next time, and that this course was introductory. I felt this is important before we proceed. If I teach you guys how to do a space maintainer in 5 minutes, and you thank me, get excited, and you're happy with that. I felt if I don't talk about this first, I'm kind of defeating the purpose. I felt this is more important. I hope you didn't mind that. if any of you believe that you cannot do a stainless steel crown in 5 minutes, or say 10 minutes at the most, you're more than welcome to come to me. I'll make an appointment, a one-on-one appointment with you, and sit down with you and show you why you shouldn't take you no more than 5 to 10 minutes to do a stainless steel crown on a primary tooth, on a type on if you want. This same thing. We're not going to do a specific course for a stainless steel crown, but we're going to do it for a space maintainer. So you don't have to compromise quality. You can do it with superior quality, and yet be efficient. And I'd like to show you how to do that. And I think you will be happy with the results. I think I've talked about everything I need to talk. Any questions for me before Saleh speaks? Yes, sir.
Will you be talking about pre-authorization from hospital?
Yes, sir.
Okay.
He'll talk about that. Yeah, he knows a lot more than me. So, by the way, I try to limit myself to my practice. As that's the way that this thing works. Is I don't want to bother about any management issues. So he's the good guy about that. Any other questions? Yes, sir.
May not be a relevant question right
Sure,
now.
yeah.
But the last example that you gave, the lady,
Yeah.
sending an apology letter, although you were not at fault,
Yes.
giving her concessions,
Yes.
refunds,
Yeah.
and offering future treatment
Yeah.
free.
Yeah.
God forbid, if she still pursues
Yeah.
to go into a court, would that hurt you?
Well, I know it's
Would
going to
that
be.
be taken as that you knew that you were at fault,
Yes.
and that's why you went forward to take that extra step so that
Yeah.
this would be kept right here?
That's a very good question, actually, because it will be discoverable in court in case you decide to sue me. Now, I'm very careful with using the word, like I mentioned in the slide. I will not say a single word that will incriminate me or admitting guilt. All the words, the apology words, were directed towards poor communication. And I apologize. We did not convey that to you properly. I'm sorry that we did not talk to you in full detail about what we should have, something like that. But I'll be very careful not to say things that I know that will incriminate me. I never admit that, yes, the orthodontist did the wrong thing by cementing it was more explanatory than admitting guilt. So I don't think, and plus, especially in that case, I don't think she had anything to pursue to sue me. There was nothing really major. There was no damage done or anything. I was more interested in focused on protecting my reputation. I just don't want to go and bad mouthing me. You heard of the alpha females terms? They call it alpha moms. They call them, and that's not my term, by the way. The alpha mom is the mom who is very socially involved and always sit down and has all those gatherings and wants to talk. And if you get one of those mad against you, you're in big trouble. You don't want one of those. Yeah.
And I'm sorry, just to follow up on
Yeah.
his point.
Yeah.
Is it, if you do write a check,
Yeah.
isn't that a reportable thing to the National Data Bank?
Well, that's
Not a court, but
yeah, yeah.
the National Data Bank.
well, the check first of all, he will answer that question. The check was first of all was meant. It's called I write the note on the check, the time compensation fee.
Oh, okay.
So.
Procedure compensation.
Yeah, because she wasted her time, because she's saying one of her complaints, my child came here 10 times, they wasted so much of my time, they waited forever, so it's to compensate you for your wasted time, I'm enclosing this a little check to make up for this inconvenience, basically so. But he'll also address that. Any other questions? Thank you very much. Then I'll talk to you. Please do the course evaluation form. Would greatly appreciate it. And any feedback would be very much helpful. Really appreciate that. Thank you. I don't know if you need that. Thank you.
Thank you and good afternoon. And my name is Sully, and I've been working with Dr. Hidlevi for past 7-8 years, managing his practice. Learned a lot from him. Great skill. I will talk about the audit process that's going on. Any state Medicaid providers we have here? Everyone takes Husky? Everyone? Okay, all right. So we are all possible victim of this audit. I'm sure that everyone knows that if you have received $150,000 in a year period from Husky as a compensation for your service, you are a possible candidate for an audit. On that note, $150,000 for the whole year. That $150,000 that was calculated by DSS, Department of Social Service, is based on fees that state Medicaid used to pay before 2009? Anyone used to take state Medicaid before 2009? Okay, so we know how those fees were, right? For cleaning, you used to get $7. For panoramic extra, $17. Extraction, $15 or something like that. So sounds very interesting. But those are the time that $150,000 mark was a big mark. But right now, when we have new patient fees, $65, periodic oral exam is $35. So fee has gone up almost, I would say, 400 times more than what it was. So now, not increasing that limit really doesn't make sense. So anyone, basically anyone who would accept Husky will have that $150,000 revenue from Husky in a year. So basically everyone is a potential candidate for an audit from Department of Social Service. Now, here's the best part. Department of Social Service went and hired Health Management Solution, a independent company, who had great success in recouping the fund back into the federal Medicaid program for a lot of fraudulent activity. Now, Department of Social Service, of course, hired them, not focusing into the fraudulent activity, but in general to everyone. And anyone that works for HMS, Healthcare Management Solution, they are not dentists, they're not a healthcare provider, they don't have medical knowledge. They are given the rules, regulations that are established by Department of Social Service, not by ADA, and they will walk into your office and they will strictly follow those rules and regulations that are established by Department of Social Service. They don't care what ADA says, they don't care what AAPD says, they care what DSS and you has agreed when you decided to participate in Husky program. Now, here's the fun part. They get paid based on percentage. If they come to your office, they did not collect anything, they don't make anything. If they come to your office, they find you $100,000 and they get $100,000, they get a percentage of it. So their goal is to make the fine as big as they can. They want to get paid more. We all do. So I know that CSDA, Connecticut Dental Society, is working really, really hard to gather all the legislators together to push a legislation through, but we all know that how that process works. If anything, if the legislation passed, it's not going to be implemented within the next 3-4 years. So within the next 3-4 years, we all are potential candidate of a Husky audit. Now, one may say, I don't do anything wrong. I'm not fraudulently charging anybody. I do whatever is good for my patient. Then why do I have to worry about it? How many of you write down on your clinical note, bite wings were taken because of this reason? None of us, right? Because that's not in ADA standard. ADA doesn't require you to write down why you are ordering radiographs. In medical industry, they do. They write down the order for radiographs, but in dental industry, there is no standard by ADA. But DSS says no. Any radiographs taken, you must write down that who is the doctor who ordered that radiograph, what is the reason for that radiograph to be taken. You cannot just say bite wings were taken and done, or panoramic X-ray was taken, or full mouth series was taken and done. You can't just do that. You have to say why and who is the doctor who ordered it. So that has to be there. PAs are big. The doctor that Dr. Levy was talking about got fined for $700,000. He never mentioned even, all he said is PA was taken. Never mentioned what tooth number and what was the reason. So you have to use the tooth number and the reason for PA that you are ordering. There goes the x-rays. Now, a lot of time, your notes does not, as Dr. Levy went over with all this, include why you were doing the procedure. You just say this procedure was done. That's not DSS is saying. DSS is saying diagnosis must be there, that this is what you have diagnosed, and then the treatment, this is what you have done. So if it's not there in your note, and you have done a two-surface composite, if you are being audited, they will ask you to give their money back. If it was that only one tooth, no problem. Here is the problem. The problem is, if your office, DSS picks up for next audit, they will send you a letter with 100 sample patients that you have attended in last 3 years. They can say, you will be audited for 2010, 2011, and 2012. They don't have to go most recent 3 years. They can go back any 3 years period. So if they give you, they will provide you 100 patients, sample patients, and they will give you 30 days to prepare yourself. And once you receive that letter, yes, your office can contact them. If you don't agree on the date that they're giving, it's not suitable for you. If it's not, you don't want to close your office because they're coming or whatever the reason may be, you're not available, you can always call them. They will work with you, but they don't want to pass that more than 30 days mark. So within 30 days, they have to be there. The key is you need to keep them focused on that 100 patients only. You don't want to open your entire office in front of them. Once they give you that 100 samples, name of the patients, it will be your office responsibility to get all their clinical notes, all their radiographs, every claim that was submitted to their primary insurance, if Husky is secondary, and if Husky is primary, then also their secondary insurance. All their insurance information history during that time, whatever, they may not have that insurance anymore, but at that time they had it, they would like to see it. And of course your clinical notes. Once you have all these, HMS will come into your office on the day that you agree, and they will go through that 100 samples. And
Do they give you the list before they come, like 100 patients?
when you will receive your letter that your office is selected for an audit, the sample will come with that letter. So once you receive that letter, you have 30 days. They may give you a possible date already on your letter, or you can call them and discuss that to change that date as well. Now when they come in, Wiggins and Dana, a law firm who are very much involved in this process, and they're working with CSDA side by side to pass that legislation and try to make DSS understand to go slow a little bit. What they suggest is do not leave them alone. Do not just give them those history of 100 patients and say, okay, you sit down, you find out what you have to do. Sit down with them, take your time. If you think that you don't have the time to sit down with them during this process, have your office manager or your billing manager, whoever you think is the right person to answer their questions and their concerns, have them available to sit with them throughout the process. Now they will go one by one, all these 100 patients, all their histories, every claim that you submitted to DSS for them, and anything that does not match with DSS guideline, they will say this is not billed right. So out of that 100 patients, let's say they are going to 10 patients out of that 100 patient, they find some problem there. And the total of that 10 patients that they think that it wasn't billed right is $1,000. They will divide $1,000 by 10. That makes it $100, right? Now, this $100 is nothing. We're good up to now, right? Here comes the scary part. Now the 3 years period that they have taken, within that 3 years period, how many claims you have submitted to DSS multiplied by that $100 is your fine. And they call it extrapolation of universe. Universe is that 3 years period. So the dentist that Dr. Libby just spoke about got fined, and his case is final, done, and he have to pay $700,000. That is a closed case. All the appeal and everything has passed through. Now, the day DSS comes in or HMS comes in, they will go through that 100 patient. They may take a day or two, but they cannot leave the building with those without your permission, because those are your patient record. They will ask you, but if they say there is a lot of other things that we have to look into it, we have to live with those information, do not try to fight it, because DSS can simply say, no, you can release those information. Technically, you have to. So you want to keep your relationship with them. So if they want to keep it in good terms, let them go with those, but just make sure it's all written down that they're taking over those records from you and they're leaving the building with those records. Now, once they are done, they will sit down with you and they will tell you what their findings are. Now, you can reason with them professionally and explain your reason for what they're citing is not right or wrong. Now, are they going to take it into consideration? It's their call. It's not our call. Now, they will go back to their office. They have 60 days to send you a letter, list those errors that they think are fraudulent or not correct, and then let's stick to that number of 10 patients that were identified as wrong. So they will send you a letter. Those 10 patients are listed and why they think those were wrong. Now you have 30 days to reply back to them. Send them a reply. Now when you are replying, do not reply just 1 or 2 patients that this is why you think it's wrong, their findings are wrong, but answer them for every 10 patients that why you think they're not right. Because if you don't object to the other 8, you're just talking about the 2, then they will just focus on those 2 patients and close the case, and the other 8 patients, they will multiply whatever the total comes up to with your extrapolation of the universe, which is not going to be fun for any one of us. So make sure we do reply back to them for all 10 patients, whatever the findings. We don't think that that's legitimate. Now they have another 30 days. So long story short, you can go for back and forth for 3 years. No problem. Every time they will send you something, you can send back to them. And you can go back and forth 3 years without any problem. But after 3 years, time will come, they will say it's too long, we have to finalize it. Now on your final review, you can have an attorney sit down with you. If you don't think that it's gonna be a very significant amount, then it's good to close the case as soon as possible, because you really don't want them to keep digging into the other problems. But if you think it's a significant amount and it's going to hurt you, then try to prolong it as much as you can, and then on the final review, make sure you sit down with an attorney. Do not represent yourself without an attorney, because if you close the case, DSS will go about it in 2 ways. One, they will demand the whole amount in one lump sum, or they can come up with a payment plan with you that until your fine is paid, you will continue to see Husky patients, but you're not going to get paid. They will hold the payment back and it will go towards your fine. And that's not going to be fun. Now, when you are preparing that 100 patient sample that they will give you, if you find among those 100 patients any of the patients that you have done a treatment, your note says you have done it, but by mistake you did not bill it. We do have sometimes things like that, right? We didn't bill it, but we have completed a procedure, and your note says that, but you just forget to bill it. Take that in consideration, keep it. Because if they don't back down from their findings, you can say, here is a procedure that I have done, I did not bill for it, I have the evidence that I have done it. Now, they also have to do the extrapolation of universe for that fee that you did not charge. So let's say if it was as simple as a sealant, and Husky pays $40 per sealant. So even if you have in 3 years, if I say the minimum number, 5,000 claims that you have submitted to Husky for that 3 years period, 5,000 times 40 is a lot. So one patient can save him. So the bottom line is, before DSS take those 100 patients and review them, you need to sit down with those 100 patients and review them and know which one is a clerical error, which one is an error that can protect you, is working on your support, on your defense. Know them beforehand, before they walk into the door. And if you see that they are here and they are not backing down on what their findings are, then you will bring them up because you already know which route you are going to take. Yes, sir.
Coming back to the point that you said that the procedure that we forgot to bill, and as per the DSS contract, there's a TFL, timely filing limit for 1 year from the date of service. So if we don't bill, can we, I mean,
It still
can be
counts,
considered as
you
an
can still
extrapolation?
fight that to give, as they are not backing down from extrapolation of the universe, you have your right to exercise that right.
Even if it's beyond TFL?
Correct. It wasn't filed within 12 months period, no problem, it was done, procedure was done, it is on the note, charted. I did not bill the patient. Now give me my money back.
It's better to leave one procedure once in a while.
Who knows if that's going to be on your 100 samples? You really don't want to attract their attention to some in a patient which is not included in that 100 patient. You don't want them to start poking into other patients. You don't want them that. If you are a digital office, everything is in your server. Do not have them sit down in your computer and open up your practice management software and go by patient in front of them. Do not do that. Print out everything and put it in a nice binder and hand them out all the printouts. Do not let them sit down with your practice management software. You just don't know where their eyes will be. They are there to get money. You don't want them to do that. Any questions so far? We're good? Yes, sir.
I do have a comment that last Wednesday, the bill was passed at the 11th hour, literally.
Right.
So
It passed. Now it will go for the Senate review.
No, it's passed by the Senate.
And they have literally another 2 years to implement that.
I don't
Right.
know what the time limit is.
So now, if you are being audited now, they are still not bound. All this legislation is giving you the only defense you are getting out of this legislation is now they have to respect the ADA code. They cannot just simply say it's a DSS code. I don't care about ADA code anymore. They cannot say that.
I believe some of the bill also said that they wanted to have, that the CSDA insisted on having a dentist sit down and review.
Correct.
It wasn't just a
Right. You can, if you don't agree with them and they don't agree with your clinical judgment that you are putting them as an evidence, then you can request a dentist from CSDA to provide a dentist. Now, it's CSDA's call. Are they going to send a dentist, a fellow dentist, to support you?
That might turn out to be a member benefit, so if anybody here is not a CSDA
Right.
member.
Then it will be a good thing.
It's a good reason to join the CSDA
Right.
because it's a.
And CSDA is really, really working hard day and night to get this going on. They are on top of it. I mean, if you haven't joined CSDA, please do so.
And
I don't work for them, by the way.
I don't mean to be taking it, but one other factor for the CSDA is the CSDA said, look, we rallied everybody together to take Husky. If you do this, you're going to shoot yourself in the foot and you're going to want.
Absolutely. 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 And the state of Connecticut now is a model for the other state Medicaid programs to follow. So Now, if CSDA wants to, if DSS wants to put themselves into a place where they were in 5 years ago, where there was no provider who would like to take Husky patients, I don't think they want to go that route. So yes, CSDA made it clear that if that's the route you guys want to continue, then this is the route we are going to pursue. So yes, they made their point very, very clear. I think somebody yes.
I have a question.
Yeah.
If they fine you, is this something that's going to be reported to national NPI database, or is this something that's going to be reported?
You know, the freedom of information, it's a law. And as a healthcare provider, anything and everything is available for the consumers or your patients or anyone who wants to know about you. Google is our best friend, and Google is our best enemy. So it's in there. And especially for the Connecticut providers, just go to Department of Health website and type in your license number. Everything is listed there. If you are cited for anything, even if the Department of Public Health inquired about something about you, it's listed in there. Any other question? Okay. Prior authorization. Now, a lot of Husky patients, Husky does not provide benefit for every single procedure. There are limited procedures that Husky provides benefit. Now, if you happen to have a Husky member who needs some treatment that Husky is not going to cover, then it is your responsibility. You cannot just simply look at the Husky fee schedule and say, okay, the code is not listed, so Husky is not going to cover it. So I can now start having this conversation with the patient saying, you have to pay out of your pocket, so let's talk about the money and then sign up an agreement and do your procedure. You cannot do that. You have to submit a prior authorization, although you know it's not a covered benefit. Husky still wants to know, Husky still wants to get that prior authorization on their hand. And once you receive the denial on your hand, with that you can do a payment plan agreement or any financial agreement that you would like to do with the patient and have them sign it and render the treatment and collect the money from the Husky member. Now, if you have done a procedure without sending the prior authorization according to the DSS code, yes, it will be counted against you. Did I answer your question to the prior authorization, or you had a different question about?
What do you mind telling me? What does your office do for, especially for pulpotomies? This is, you know, it's an emergent procedure many times, and they want, I know they want stainless steel crowns pre-authorized, but they even want pulpotomies authorized. How do you guys deal with
Well, as a right, sir.
It's a pediatric procedure.
It's a pediatric procedure. For our office, in that case, we don't have to send a prior authorization for pulpotomy or stainless steel crown for the children because we are pediatric specialists. But yes, GP must submit a prior authorization.
No, it's a post-review.
It's a post-review
It's a
procedure.
post-review procedure.
You can do pulpotomy, submit PA, pre-op and post-op.
But not the crown.
Not the crown.
Yes,
Right.
not the
The stainless steel.
Pulpotomy is a
so
post-review
if the kid
procedure.
needs a pulpotomy, you do the pulpotomy?
Yeah.
Okay.
Right. Then you send the post review with your claim,
Okay.
and it must be there. Without that, they will just deny the claim,
Sure.
and then you have to go and submit it. Just waste your time.
What about root canal in our patient where the patient is missing a tooth in that same quadrant? We know for sure Husky's going to deny it. Patient needs that root canal. Do we still go over those 6 weeks of pain and agony for the patient?
You know,
And
you
forget all
can
the
submit
ethics?
the prior auth online, and the process is much more quicker. Within
Still takes
It
4 to
doesn't
6
come
weeks.
less more than 4 weeks.
once you submit online, within 48 hours you can call them. Over the phone, they should be able to give you an answer. If they tell you that it's still on review, tell them it's an emergency. This is the situation. The patient is in pain, and they will expedite that. They will, within 48 hours, they will call you back with a prior authorization number, if on that case. I have done it a few times. Yes, sir.
You have a guideline saying like, that will never be paid.
I'm sorry?
Like the root canal, if you have certain teeth missing in some quadrant, do not pay, that's guideline. So,
If they deny it, now you have the denial on hand, and you can make a financial arrangement with your patient and go ahead with the procedure. But you cannot do the procedure without they denying the procedure.
I have a question about the fee. If, let's say, there's a tooth missing in the quadrant and we are doing endo on that patient, are we allowed to charge our
Office fee, no. You
office
still
fee,
have
or
to
it has
go
be
by
a
the Husky fee,
for
correct.
the root canal?
Yes.
which one?
Even-
Office or hospital?
Even if,
Husky.
I'm
Even
sorry,
if
I'm
the
missing
procedure is
this.
not covered.
Even the procedure is not covered, you still have to go by Husky fee schedule. It's just like if you have a Delta Dental patient
yeah.
and they are already over their $1,500 yearly maximum. Now you are going to do a procedure. Are you going to charge your office fee? No. You're still going to abide by Delta Dental PPO fee that you have agreed on. It's the same concept with Husky.
There is an exclusion of that contract. I mean, you can exclude from that. It's allowed.
If you are on a premium provider network and you don't accept to PPO, then you can. But if you are not, if you are taking PPO and also premium, then only you can do it if the patient's card strictly says premium
Your own, yeah.
only. Yes. Any other questions? Did I answer everyone's questions so far? We're good?
What if the procedure is not listed on the Husky manual? Then we are allowed to charge our.
Prior authorization must be submitted even if it is not listed as a.
About
As
the fee.
the fee, if it's not in the Husky thing, then you can go with your office.
Basically, if you're taking Husky, you can't touch these patients without anything that happens. you
Right,
have to-
because your DSS agreement says that, let's say you have a Husky patient, you rendered treatment to that Husky patient when they were not eligible, but you rendered the treatment as a Husky patient, right? Now, then you realize they weren't eligible and they denied the claim. Can you now send a bill to the patient? The answer is no, because you treated them knowing they're a Husky patient and you cannot bill them for the procedure while they were not eligible. You have to just write it off.
What about Saturdays? You
What?
can't check, let's say the website is down, there is nobody on the phone.
If you
There's
rent,
no way for you to check whether they're eligible at this point in time or not, but the patient needs the procedure. We
then
just close our eyes and say, well,
then you as a provider make that decision. You cannot say that I will do the procedure. If Husky pays, then it's okay, and if Husky does not pay, you will pay. No, you cannot do that. If Husky pays, you take the money. If Husky does not pay, you write it off. Simple as that. I'm sorry. Good thing all of you had already had your dinner, so I'm not gonna feel guilty of losing your appetite for dinner. So I'm okay. I know it's tough night going on. Any other questions? We all said about it? No questions? Okay. All right.
Looks like your talk is a lot more important than mine.
Well, that's money.
You got all the questions.
Yeah. Don't touch my money. Everybody is serious about their money. Yeah. They're talking about money. So thank you, everyone. And if any one of you have any questions, and you can find. Oh, one more important thing that I would like to cover, because when I went and attended the CSDA meeting, and Jen and Wiggins consultation firm was there as well, and a lot of dentists raised their concern about saying that. I have spoke to Donna Bolaski about this, and she told me it was okay to do it, but now I checked the DSS manual, it's not there. Is that okay to do something, although it's not in the manual? I did not go back and check the manual. I just took her words, thinking that she is the medical director of DSS. Why not taking her word? The answer is no. When you signed the contract with DSS, you signed with fully understanding that you will abide by their law. Any of their officials, just their verbal consent does not override anything that they have said, written down.
You probably have that in your contract.
Yes.
I have a question. I heard something with, talking to other folks. OSHA also now start auditing in a couple of offices are fine. Is this something triggered by employees, or are they really doing it the same way Husky is doing?
Your audit can be triggered in few different ways. One is we call it whistleblowing. If any of your employee or your patients, in this case that Husky is doing, calls the authority and saying they are doing something wrong. So then it will trigger an audit. They will come in and look for problems. Other one is just a normal routine procedure. That they take some samples every year, randomly pick, go to some offices and try to find out. They're taking a salary, so they have to do something. So they go to different offices, check things. They find something small, minor. They will leave you a warning. Something major, they will give you 30 days to fix it. They will come back. If everything is good, life is good, they will go back. But if it's something that comes in, they give you a warning, and after 30 days they come back, it's not fixed. Now you set yourself for trouble. They will keep coming back onto your door. HIPAA, OSHA, they really don't come in every day knocking on everybody's door. Most of the times they're triggered that somebody called them and gave them a clue. They don't have the resources to go out and look for trouble without somebody calling them.
I have a question about the lab fees. Let's say we have done 4 or 5 visits towards any lab procedure, and patient, we don't end up completing the procedure. And I did had a phone call with the CTDHP, representative, and she's clearly told me I'm allowed to bill the patient up to the time or the lab fee, the actual lab fee that I incurred. And if the patient does not complete the procedure in my office and chooses to go somewhere else. Is that true? I have that phone call recorded actually. But I don't know if that's
I will caution you on that is CTDHP employees, especially on their phone representatives, a lot of times they are not most knowledgeable people. So if they tell you something just over the phone, don't take that answer as a yes. If your gut feeling tells you that doesn't sound right, and you check your manual, it's not there, then ask them to have that communication in email is better. Now you have a written document to base yourself, and ask them what guideline they're citing when they're giving you that approval. I would do that. I'm not just going to take their answer as a yes and move on, because if that becomes, and then you say, I called them and this is the person, I have live recording, it's not going to work for you unless you have a written document to provide that. If you have it recorded, I would assume that will work as your defense, because you have it recording about it.
As long as you
But,
told them.
right, you cannot just say, I spoke to this person on this given day, or I spoke to someone at DSS. That is not
the
going
only
to
thing
work.
in the state of Connecticut, you have to inform the other party that you're recording
Right.
the call.
Otherwise it's
That-
not-
Right, you cannot just record without letting them know that you are recording the call, correct. So that's a problem. That's why email is the best thing. If you're not sure about it, I know you already have the conversation, you don't hurt their feeling by saying that I'm doubting your judgment. Just say, I'm just summing up our conversation, and this is what we have agreed, this is what you have told me, and I'm just, please confirm. And that's it. If they confirm me, we have a written document, scan it and keep it in the patient file. Any other question about audit before I move on to the one question that Dr. Libby left for me to answer about that question that you had about the check, sending somebody a check, and so we can move on to that? Okay. On this case, the check that you are giving that patient is not refunding anything for the treatment that you have rendered. You are giving that as a token of appreciation. It's a gift because you are acknowledging her feeling. You are not admitting your fault. That is totally okay. So the letter that you are writing to your patient, if that is scanned, the check is scanned, it's there. So if she decides to bring it to a court as a defense saying that this is what I got, she admitted his fault, I can always print it out and say, this is the letter I gave her, this is the copy, and this is the check. She cashed it on such and such date. If she had problem, once she cashed it, she accepts my apology, and she cannot just bring it back again saying, no, he gave me money, I took it, now I'm going after him. It doesn't work that way. No. Once you cash the check, you can find your comfort level. Your attorney will also tell you that, yeah, that's a comfort zone once they cash their check. If they didn't cash their check, then you know they're looking for something else.
What about promise for future treatment fee?
You can
That is not getting any refund for.
You can do free treatment to anyone you want. All you have to do, just submit it to their insurance company with a zero balance, zero fee. Make sure you submit it to their insurance company. Do not render the treatment without submitting to the insurance company. Insurance company wants to know if they have insurance that treatment is completed by you and you have done it free of charge. It does not make you admitting to your fault or trying to fix something. It does not. This treatment has nothing to do with the prior treatment. But you are not going to continue to treat them free for whatever thing. Probably it's a one-time thing that you are going to say that you are acknowledging that they have lost some time and you have respect for their time and that your relationship with them. So that's why as a one-time courtesy, you would like to give them that opportunity. Best thing to do is just give them a monetary cash value, a gift card or a gift certificate saying, this is one time, enjoy it, and call it a day. Thank you very much. Thank you, everyone. So if anyone have any other questions, please feel free to email Dr. Idlibi. If he thinks that I will be the right person to answer that question, he will forward it to me and I'll get back to you as soon as possible. Thank you all.
Please grab one of those gifts. We promised you something from the, if you will, from first 50 registrants. So that's yours.
Okay.
And you can always call me again or email me if any questions. If you have questions for me, probably it's going to be more likely for him. So we'll find the answer for you and email you back.
Yes, sir.